So let's talk about the side effects of some of these drugs that we've gone through, and this could be its own conversation in itself, but maybe by class. So maybe I'll start with a class. I'll start with the class of tyrosine kinase inhibitors, and I really put the tyrosine kinase inhibitors into kind of two buckets. I have the neratinib, lapatinib bucket, and then I have tucatinib, which I put in a little bit of a different bucket. So the side effects of lapatinib and neratinib, it's a pill. It's something that somebody can take at home. They're not having to go into the IV infusion center or need a port for these type of therapies. In general, it's pretty well tolerated. The biggest side effect or side effects maybe two that we tend to see with the tyrosine kinase inhibitors is not unlike other disease types. It's the rash and the diarrhea. And remarkably, those side effects don't come from the actual blocking of HER2. It comes from blocking HER1 or EGFR, and these neratinib and lapatinib inhibit both of those. And so I do have patients that struggle with diarrhea in particular on these therapies. We often can manage that with something like Imodium, Lamodal. Sometimes we need to employ dose reductions. Tucatinib is a little bit different. It too is a tyrosine kinase inhibitor. It's also a pill that you're going to be taking at home. It does not inhibit EGFR or HER1, so we don't tend to get as much rash and diarrhea. Now, interestingly, the regimen it's approved with is capecitabine trastuzumab, and we do get diarrhea with capecitabine. So it's not that we're not going to see any diarrhea from this regimen. I just don't think the tucatinib adds a whole lot to it. And cumulative with these regimens, we see fatigue. Some people can have a little bit of nausea, but I find that pretty manageable. What do you think, Stephanie? Why don't you pick another class and go through a little bit of the side effects of those?
Sure. I'll just take trastuzumab as our sort of grandfather drug in this space. So antibody or the IV HER2 anti-HER2 agents like trastuzumab and pertuzumab. Trastuzumab in and of itself is a relatively innocent drug. Patients do well with it. Patients can have allergy-like symptoms. Typically, we are able to mitigate that with our standard, antihistamines or steroids and make it manageable. And then obviously we worry about cardiotoxicity. And so in some of the earlier HER2 studies, we saw high rates of cardiotoxicity, but those largely have been eliminated by not using the medicine in combination with anthracyclines. And we've also had updated data recently from ASCO showing that anthracyclines in the HER2 positive adjuvant or neoadjuvant space really is not additive, and I feel no longer has a role in the treatment of breast cancer, early stage breast cancer, HER2 positive early stage breast cancer. Keep adding my little caveats on that. So when used alone and without anthracycline, the cardiotoxicity of trastuzumab is low, less than 5%, 2 to 3% in most studies, and often is reversible if you're just monitoring their echocardiogram or MUGA at regular intervals and take a break with reductions in the ejection fraction until you see a recovery. There's clear evidence from our cardio-oncology colleagues showing medicines that can be preventative. So if you have a patient who's high risk, you can consider adding ACE inhibitors or other medicines to try to optimize their cardiac health in appropriate settings. And then obviously things like smoking cessation and exercise are critical for all of our patients. Otherwise, trastuzumab tends to be a really well-tolerated drug. When we add pertuzumab to trastuzumab, which is, they're almost always used in combination, we do see slightly higher rates of diarrhea, but still a very well-tolerated combination. And in my experience, the diarrhea is manageable with our standard antidiarrheal agents.
Absolutely. So I'll take the antibody drug conjugates, and again, really two in that class, TDM1, and then also a drug we haven't talked a whole lot about today, trastuzumab deruxtecan, or DS-8201 as it used to be known. TDM1, I think we've talked about a little bit. The biggest side effects are really low platelets, elevated liver function tests that are reversible with dose hold and dose modification as needed, and then some fatigue. We'll spend a little bit of time talking about trastuzumab deruxtecan too, since it's new to this stage and recently approved, really showing quite impressive response rates, very impressive duration of benefit for the vast majority of patients that are benefiting there. It's interesting, same with that, a little bit of low level nausea, not the type of nausea that I anticipate with anthracycline and taxane type regimen, but we still, have some patients that do need some nausea medicines for that. The side effect that's gotten a lot of attention, and I think one that we really have to educate ourselves about and be very cognizant about, is the interstitial lung disease. And so this is grouped in this pneumonitis type category. But what we've seen with this drug is that about 2% of the time this can be fatal. And this really happens when the interstitial lung disease kind of shows up and it's grade 3 or grade 4. Oftentimes those progress to a grade 5 or a fatal case. When we can catch that inflammation in the lung, either based on an asymptomatic CT scan for staging purposes, or somebody says, I was just a little bit winded walking to the mailbox, and so it prompts us to get a scan because we're looking for this, that those are often situations that we can start steroids and easily reverse this and get patients back to their baseline. I think it's a little bit challenging though, because we've all gotten more familiar with pneumonitis because of immunotherapy across tumor subtypes. And this is a little bit different with trastuzumab deruxtecan because, we're holding trastuzumab deruxtecan for even more mild cases of pneumonitis to make sure that it doesn't progress. So I think this is really an opportunity for us to educate not just ourselves, but our ER providers, our nurse practitioners, the primary care doctors, that the patient may say something at their office and doesn't really relate it back to their therapy. And also the patients themselves to say, hey, I'm on a drug that may cause pneumonitis, to have a card in their wallet so we can catch this early and prevent it. Otherwise it's an extremely effective drug and one that works even in quite heavily pretreated patients. So I think that's a huge advantage.
Yeah, and I would just echo the interstitial pneumonitis is, early onset symptoms can rapidly progress to being fatal. And so I think that it's something, now that it's commercially available, I've had team huddles with my chemo infusion nurses and have them on high alert as well as they're getting ready to start a dose. They're kind of screening patients to ask them. During the middle of the coronavirus pandemic, obviously we all have a heightened sensitivity to cough and shortness of breath symptoms, and trastuzumab deruxtecan just is a part of that any of those patients that are having any sort of symptoms like that just need to be very carefully screened, and we really need to celebrate our whole care team, whether it's our infusion nurses or nurse practitioners or partners, when they're pausing on somebody on trastuzumab deruxtecan with interstitial pneumonitis symptoms and taking the time to fully turn over the stone before deciding if it's safe to continue on that drug.